Hello, everyone, and welcome to For Head's Sake. I'm Dr. Lindsay Weitzel, founder of Migraine Nation and chronic daily migraine survivor. I am excited to let everyone know that I am here today with Dr. Michelle Clementi. Hello, Dr. Clementi, how are you?
Hi, thanks so much for having me.
Thank you for being with us today. Dr. Clementi is a pediatric pain psychologist at the University of Colorado Children's Hospital. She is here today because she is an author on a recent study that is very pertinent to our topic today. She is going to share with us some data related to how chronic migraine in children can infect the entire family. I find this topic to be so important. It's close to my heart. I hope that everyone will listen in and find something that relates to them in our talk today. I was a child with chronic migraine forever. It started when I was 4. I have a son that was diagnosed with chronic migraine when he was age 7. So I am so interested in what Dr. Clementi is going to tell us today. So Dr. Clementi, first, let's talk a little bit about why this study was carried out in the first place. Is there evidence that having a child with chronic migraine affects the parent and that the parent's responses and attitudes then affect the child's pain experience? Because what we're talking about today is basically parents of children with chronic migraine and how there's like an interaction there. The kids affect the parents and the parents affect the kids. So was there data out there already that this relationship existed?
Yeah, absolutely. And I think, we can speak to that both from a clinical perspective, right, of what people are experiencing themselves and from a research perspective.
Mm-hmm.
So I'm sure as you and many of the other listeners have maybe experienced themselves having a child with chronic migraine, it can definitely affect parents. So, it feels terrible to see your child in pain. And sometimes
Mm-hmm.
when a parent has migraine themselves, it can be especially hard because you know what that pain experience is like.
Right.
So it can really take a toll on parents and kind of on the whole family, right?
Mm-hmm.
Causing parents to like adjust work schedules, impacting siblings, sometimes causing financial challenges and definitely impacting family activities together. So
Right.
then on kind of the other direction too, we know from almost 2 decades of research in pediatric pain that parents' responses and their own emotional health can have an impact on a child with pain. So a lot of that research has really focused on when parents are really highly distressed about their child's pain or particularly protective of their child, like limiting certain activities because they're
Mm-hmm.
concerned it might increase their child's pain. We know that this can actually be associated with kids having more disability, so more trouble doing their daily activities, and then continuing to have more problems with pain in the future.
Right. And one of the ways that I see it, which might seem sort of rudimentary, is I do so much of these podcasts on how our minds and our moods affect our own migraine and our own pain. And then
Mm-hmm.
when you have a child with migraine, and I know this because I was a child with migraine and with chronic pain, they have their own mood that they have to deal with, right?
Yeah,
And then they have
right.
to deal with yours. So that's
Mm-hmm.
why we have to be so careful because they can feel yours too,
Totally.
right? And so I feel like that's why we do have to be careful, and that's a burden on us as parents. And so we have to be kind to ourselves and take care of ourselves, but be aware that the child's dealing with their own pain and their own mood and stuff, and then they're also dealing with ours.
Right.
So right. So in the work you did, you measured something called a PRISM score in the
Mhm.
patients of children with chronic migraine. Can you talk to us about what the PRISM score is?
Yeah, sure. So PRISM stands for Parent Risk and Impact Screening Measure. And it
Mm-hmm.
was developed by researchers at Stanford University and Oregon Health and Science University, along with an expert panel, really to assess how a child's chronic pain impacts a parent's own well being. And so,
Mm-hmm.
really, the reason why I was doing this study is because we want to see how we can identify parents and families who need some extra support in these areas when the
Mm-hmm.
headache team and I meet with them in clinic, because there's just so much information that needs to get covered. And sometimes checking in on that kind of stuff just kind of gets overlooked. So the PRISM is intended to be used as a screener. It's kind of a quick way to get information from parents at their medical appointment to see if they need some additional support.
Right.
Um, So there's kind of 4 different categories that make up that PRISM score.
Okay.
So the first one is about parent distress. So like feeling overwhelmed by their child's pain, worrying about their child's pain all the time. And of course, it's totally normal to be concerned about your child, right? In
Right.
some ways, I'd be concerned if you weren't concerned.
Mm-hmm.
It's really horrible to see your child suffering. And yet, like everything else, there's kind of a spectrum where if you're on one end of really being so consumed by that worry, we want to know so we can help you cope with that.
Mm-hmm.
So then the second category is parent protective behavior. And so that
Right.
asks about whether a parent allows their child to skip doing chores or miss school or sleep in later because of migraine. And again,
Right.
this can kind of be a tricky one because
That is
obviously migraine
hard.
affects a child's life, right?
Yeah.
And like sometimes missing school and activities just has to happen.
Right.
And so the reason we ask about this though is because when a child has chronic migraine and they're getting more and more disengaged from life, this can
Mm-hmm.
actually end up causing more problems that make it harder to manage migraine. So like if they're
Right.
missing a ton of school, falling behind and feeling stressed about that pile of makeup work, feeling lonely and disconnected from their friends, that can really affect a kid's mental health. And
Mm-hmm.
when a person's feeling more depressed or anxious or stressed, it's a lot harder to cope with migraines. So it kind of leads to this vicious cycle of missing out on life, more stress, more missing out.
That one is the hardest one for me
For
because it's
sure.
hard to know when to push and to, know when, okay, they really cannot do anything right now. It's a difficult one. So I'm so glad
Yeah.
that you brought that up. So what is the next one?
Yeah, so the next category is about family impact. So asking questions like, are your family routines disrupted by your child's migraine? Is your family life stressful because of their
Mm-hmm.
migraine? And again, I would often expect this to be the case, but it's not always. So we're
Mm-hmm.
asking these questions because we just want to know for each individual family, how much has migraine really taken a toll?
Mm-hmm.
And then that last category is parent mental health. So it asks about really 2 kind of key pieces of depression for parents. So feeling
Mm-hmm.
sad or down, and feeling like you don't get much joy out of the activities you usually enjoy.
Right.
And so these questions are super important because, just like at an airport or on a plane, when they say you need to put your mask on before you assist others, when a parent's struggling themselves, it's really hard to support your child with migraine to the extent that
Yes.
you want to.
Yes. So important. Okay. So really quick, can you just
Mm-hmm.
label the 4 again for
Sure.
review?
So it was parent distress,
Mm-hmm.
parent protective behavior, which isn't maybe the best term, but that's about
Right.
sort of missing more activities and stuff.
Yes.
Family impact, and then
Mm-hmm.
parent mental health.
Okay. All right. So just so that everyone's clear, how old were the children with chronic migraine in this
Mhm.
study when you were measuring the PRISM scores of their parents?
Yep. So again, these were families who were all seen in our hospital's pediatric headache clinic, and the kids were between the ages of 9 and 19. So rather
Okay.
wide age range, but really capturing kind of the ages when we're seeing chronic migraine.
Right.
I do know that your child with chronic migraine is younger, and I will point out too that the PRISM questionnaire was developed just for older children and adolescents, so
Oh,
age
okay.
8 being the youngest. But of course, I think it's super important that parents of younger kids with chronic migraine get help as well. So I think,
Mm-hmm.
either using this screening questionnaire with slightly younger parents or developing something new that can really capture that with younger ages will be really important in the future.
Right. So according to the PRISM scores in your study, how are these parents of kids with chronic migraine being affected?
Yeah, so overall, the PRISM score can kind of be divided into 3 risk categories. So high
Okay.
risk, moderate risk, and low risk, with
Okay.
higher meaning that parents are particularly struggling with their child's migraine disease.
Okay.
So we found that of the parents who completed the questionnaires, they actually tended to fall kind of equally into those risk categories. So about a third were low risk, so generally doing okay. A
Okay.
third were considered moderate, and then a little over a third, so 41%, were considered high risk.
That's a
And to
lot.
me, that's a pretty large amount,
Yeah.
41%, really indicating that we need more support for parents of kids with chronic migraine.
Mm-hmm. For
Um,
both the sake of the parents and the sake of the kids,
for
because we
sure,
know it's a two-way
exactly.
street here. Right.
Exactly. Because back to your first question of how do they interact?
Mm-hmm.
Um, And so we saw like 75% of parents say they worry all the time about their child's pain. Over half said family life is stressful. So I think in some ways, I hope that this can communicate to maybe some listeners that they're certainly not alone and they're struggling. And again, I think it just means that we really need to make sure that we're getting parents connected with supports for their own coping.
Right. So now, one of the constructs, as I was reading the data that you sent me that it discusses, is poor parent family functioning was one of the things that was being measured, correct?
Yeah.
What does it mean when these types of scales refer to poor parent family functioning?
Sure. So when we refer to functioning, I think of that as things that you have to do and things that you want to do. So for
Right.
kids, they have to go to school and they want to spend time with friends or do other
Right.
activities. For parents and families, they have to keep up with responsibilities like work and chores and caregiving, and they want to do enjoyable things together as a family or with their own friends.
Mm-hmm.
So when we say that responses on the questionnaire might show that there's poor parent or family functioning, we kind of simply mean that the child's migraine disease is unfortunately getting in the way of parents and families from doing the things that they have to do and that they want to do.
Right. Okay. So what are some of the parent traits or characteristics that were related to the poor family functioning when the child had chronic migraine?
Yeah, so our study didn't actually look directly at parent traits and characteristics, but we did find, unsurprisingly, that kids who were experiencing more frequent and severe migraine, this had a bigger impact on the parent and the family.
Okay.
We do know that there's a group of pain psychologists at Seattle Children's who have done some really great work in the area of specifically looking at parent traits that can be related to functioning. So, for example, one study they found teens with migraine and tension type headache. With those kids, more of that protective parenting behavior. So again, stuff like sort of limiting school or activities because of concern their child can't really cope.
Right.
More of that was related actually to teens having more frequent headaches 6 months later. So
Wow.
I sort of
Okay.
think of that again as maybe that cycle of more missing out on things leading to more emotional problems, which can make headaches worse.
Definitely.
Yeah.
Okay. That is a hard one. And I have an example of that happened just this week because my son at school just started and he had missed a bunch of days that were surprisingly just at the start of school due to migraine, and then he had a cold. And all the kids at school had a cold, and it wasn't COVID, and everyone was tested. And I sort of had to push him to go back to school when he still had cold symptoms that I think a lot of kids would have stayed home from. He, wasn't contagious, no fever, but he was not feeling well. And it's one of those things where sometimes that's one of the things we learn with migraine. We are tough. We might have to be tougher than some of the other kids.
Yeah.
That sounded, gosh, I hope that didn't sound bad, but I did write a book about this. It's called Super Zoe, the migraine hero. And I was telling him, this is how we become the migraine hero. Sometimes you got to be stronger. And he was so much better by the end of that day. And had he missed more school, where would he have been? So this is one of those things that as a parent, it's a tough decision to balance.
So true.
It is so, so tough. And so my heart goes out to those parents that, maybe if you didn't have migraine as a child, and it might be harder to make those decisions. So I can see where it could be so hard.
Absolutely.
Yeah.
So, I think that's a big question I often get from parents is how do I find that balance of pushing versus holding back and letting them rest? And it's really, really hard. I think that just kind of keeping in mind that sometimes it can just snowball more than we see in the moment, right? When you're living your life, you don't notice it until in retrospect. And so I think, just keeping in mind, sometimes to give a little bit of a nudge. And I think along with that, though, helping your child think of how do they cope if I'm giving them that nudge, right? So giving your son that push to go back to school, hopefully he also has some migraine accommodation set up at school where he has the option to take a break, or he has, the option to, have, I don't know, extended time if he had a test that day or something, if he wasn't feeling his best. So reminding them we've got these little things that are there to help support you, even when I'm giving you this push.
Right. So what would some traits or responses be that parents should strive for? Like, obviously, in the research, they were looking for things that were related to sort of a not so great prism score. What in your mind are some things that we should be striving for that are more positive?
Yeah. So I think one piece of that is thinking a little bit about how parents are managing their own distress, which I
Right.
totally acknowledge is much easier to talk about and much than it is to actually do.
Yeah.
But what I think about is how some of the research has also shown that when parents are more distressed about their pain, about their child's pain, their teens actually had more frequent headaches and more disability 6 months later. And I think about that a little bit in terms potentially of some observational learning. So basically meaning like kids can learn how to feel and respond by observing how their parents are responding.
Right.
So if a parent is very scared and upset about their child's migraine, their child probably will be too. And that can end up making pain even harder to cope with in the moment.
Right.
So, I really encourage parents to try to be aware of how much their own distress is maybe clear to their child. Again, super hard thing to do, but, expressing that confidence in your child's ability to cope with their headache, or confidence that things are going to get better, you're on the right track, or that day you're encouraging your son to go to school. Like, I know you've got it. You're so strong. That kind of stuff can really rub off on them and help kids kind of develop more resilience and ability to do the things they want to do and have to do, even when they're not completely pain-free.
Right. I always tell parents, I sometimes give talks to parents, and I'm always telling them to see their child as more of a superhero than a victim when it comes to having a child with migraine or chronic pain. And I feel like that's so important because, your child sees themselves how you see them sometimes.
Yeah.
And so I just always feel like that's so important. And when it comes to taking care of ourselves, these moms, they get so worried and that they only take care of their child, and then they don't realize how that affects the child. And so we have that fill your cup, and then people always assume that means so that you can pour out onto your children. And I always like to say that it's not really what it means. You have to fill your cup so that it overflows onto your children, because if you just keep emptying it out, eventually that's just not going to work for everyone. And so I always try to, obviously no one is perfect at this. And I have to admit, the start of school this year was rough on us. And I was like, oh, fill the cup, fill the cup, fill the cup. Come on, And so, but I always think that that's the goal, is just to keep filling it till it overflows onto the kids, because they're probably not going to be okay if you're not okay. So that is how I always think about it, and I try to be kind to myself and take care of myself too. So what should parents do if they feel like they want to talk to someone about how best to deal with a child's pain? Because dealing with a child's pain is so hard. And we always need to be kind to ourselves about it. Don't assume that it should be easy on you. Especially if you were a child in pain, or you are currently in pain, and you're assuming that your child is feeling the same pain as you. These are things that, you can go talk to someone about. So what are the steps to take to do this if someone wants to talk to someone about it?
Yeah, I think you're so right. It's so important that people have support. And for some people, support is having a close friend that they can confide in, right? For other people, support is getting more professional support. And I often kind of think that a combination of these things is really good. So one resource that I would recommend is actually a parent support group offered through the organization Miles for Migraine. So this is a virtual group of parents from across the country who have a child or children with migraine. And they offer really great support, advice, and a lot of hope for each other. And just, talking to others who understand your experience, I think can be really meaningful and helpful. So I've been helping facilitate that group recently, and you can find more information about it on the family programs page on the milesformigraine.org website. Another thing I recommend is asking your child's doctor if they know of a pain psychologist or a health psychologist that can help support both your child and your family dealing with chronic migraine. So as a pain psychologist myself, even though technically my client or patient is the child, as we talked about already, the child doesn't exist in a single
No.
area, right? Everything interacts with them. And so
Right.
sometimes I spend a lot more time talking with parents about how they can be coping.
Mm-hmm.
I understand finding a pain psychologist is they're few and far between, but asking your
Yeah.
child's doctor if they know of any recommendations. I think also it can be really useful to get connected with a therapist yourself, even if it's someone who's maybe kind of more of a general therapist who isn't as familiar with pain or with chronic migraine. You know, I'm sure as a parent, you are used to educating people and advocating and all of that. And so maybe
Mm-hmm.
giving some of that education up front can be useful. And then they can really help you kind of find how to process these experiences and find ways to cope, even if they're not as familiar with migraine.
Mm-hmm.
And then kind of my
Right.
last thing is just putting in a plug for two books that I have no connection to, but I have found to be very helpful for
Right.
families. These are specifically for parents of children with chronic pain, including chronic migraine. So
Mm-hmm.
one's called When Your Child Hurts by Rachel Coakley, and the other is
Mm.
Managing Your
Yeah.
Child's Chronic Pain by Tanya Palermo and Emily Law. And both are just have really helpful tips on supporting your child to help them get back to kind of living an enjoyable life, even if pain is still there.
Right. Thank you for that. I think books can be so helpful to people because you can go back and read certain parts of them
Mm-hmm.
when you're having a moment. I do that all the time. So thank you for that. Thank you so much. Is there anything else you'd like to add to our topic today before we go?
Yeah, I just want to end kind of by saying that every parent is really doing their best in really tough circumstances. You know,
Mm-hmm.
you're doing so much. You're taking care of other kids potentially in addition to your child with chronic migraine. You might
Oh,
be
yeah.
working outside the home. You might be caring for an elderly parent. There's just a lot of stressors. And I think it's super important to remember to be kind to yourself.
Yeah.
So I like to really think about like, what would you say to a friend in the same situation? You know, would you tell them, oh, you're not doing enough, or this is all your fault? Like, of
Oh,
course not, because it's
yeah.
not true, right? It almost
Yeah.
feels uncomfortable to think about saying that to someone else. So why
Yeah.
would you say that to yourself? Right. So
Exactly.
just remembering to be kind and gentle to yourself the same way you would be with a friend. And I think just remembering there's a lot of hope for kids and families out there with chronic migraine.
Yeah, and I think something I have that works for me. I don't know if it worked for anyone else. I have learned that it's okay to say just a minute if
Mm-hmm.
I am starting to feel overwhelmed. You know, one kid has a migraine and the other one's had a rough day or whatever. I might
Mm-hmm.
have to go take a minute before
Mm-hmm.
I tackle helping them. I might have to help myself for 5 minutes. You know,
Mm-hmm.
just calm down, breathe, meditate, whatever it is that works for you. And it is okay to say just a minute. You don't have to fix that problem right that second. And sometimes you come back and you find that one kid's fine.
Right.
So
And what a great lesson for them that they sort of learned how to regulate or problem solve or whatever it was in their
yeah,
own time while you
exactly.
took care of yourself for a moment.
Exactly. So yeah, that's something that I've learned is very helpful is if you're not ready to help, then you might not be ready to help, and that's okay.
Yeah,
So
absolutely.
yeah. All right. Well, thank you so much for being with us today, Dr. Clementi. I love this topic. I hope it was helpful to everyone. Please join us again next week on For Head's Sake, the weekly webcast and podcast of the National Headache Foundation.